Discontent amongst junior doctors, fueling fears they may now go on strike, of course, after last week's industrial action by the nurses and paramedics and ambulance drivers. Now, a recent survey showing that 2/3 of junior medics have, quote, actively researched leaving their jobs from the NHS in the past 12 months as they prepare to ballot on the strike action. That coming from the British Medical Association. Its survey of 3,819 junior doctors across England in November and December, revealing 79% had often thought about leaving the NHS. Well, joining us now to discuss the issue is GP Dr. Anita Raja. Anita, thank you for your time joining us once more. And of course, the impact is, in terms of the junior doctors disappearing, not just on the hospitals, because many feed through eventually to become GPs.
Certainly, and we must understand that the term junior doesn't really explain what these doctors do, because anybody who is below a consultant level could be a junior doctor with vast experience. Anyone who's been working as a registrar, a senior registrar for over 10 years could be a junior doctor just because they have not completed their training yet. We're seeing some very, very disappointing and dire figures. And you and I, all of us know why this is happening. Junior doctors have worked relentlessly throughout the pandemic. They've put their lives at risk, significant sacrifices we've seen many doctors and many nurses die during the pandemic, pre-vaccine rollout. And of course, there's an enormous contribution from their part. But unfortunately, when we look at the pay, the real term pay cut has been more than 26% since 2008-2009. And I am not joking. I am not just saying this. There are foundation year doctors who can't afford their rent. They can't afford heating their houses. They can't afford buying food towards the end of the month. So there is a huge crisis here.
Yeah, indeed. And I think there's a hospital trust up in Newcastle that's organised food banks and help for its medical staff and effectively a soup kitchen to keep staff fed. But I'm just looking at sort of drilling down into the research a bit more that the BMA has done. It's not necessarily that they want to leave the profession. I mean, many are talking about going abroad and going to New Zealand and Australia, so continuing in their jobs, but with better conditions and a better rate of pay.
I mean, we've got to understand that when a doctor becomes a doctor, there is approximately 100,000 debt on them. They've put their whole youth into studying. These are highly qualified professionals, very educated members of the society, the cream of our society. Of course, they have the right to move to better, brighter lands where they are appreciated and where they can have a better quality of life. It's very difficult for a doctor to qualify as a doctor and then say, we're going to quit and move on to a new profession. So yes, if you look at the BMA survey again in a bit more detail, 1/3 of the doctors are actually thinking of leaving in the next 12 months if they get the opportunity to leave. And I personally know so many doctors and nurses who, as we speak now, are actually working in Australia and New Zealand. Better pay, better weather, more appreciation, and definitely not the risk of burning out.